For decades, laxity has been the cornerstone of ACL injury evaluation, providing a straightforward measure of joint instability. Traditionally, it's assessed through methods like radiography or the Lachman test, the latter widely used for its simplicity and practicality. However, as our understandings of biomechanics advances, it's clear that these static methods fall short. They offer only snapshots of ligament behavior, failing to capture the dynamic forces acting on the ACL in real-world scenarios. But what if there was a method to go beyond these limitations? One that goes beyond single-point measurements and uncovers the full biomechanical picture? Unlike laxity, which measures tibial displacement at a fixed force threshold, such as 134 Newton, for example, compliance provides a dynamic assessment. It evaluates the entire force displacement curve, uncovering how the ligament responds as forces increase. This curve doesn't just show displacement, it reflects the ligament's stiffness, or its ability to resist deformation. Stiffness is a familiar concept in orthopedics, often used to evaluate ligament strength. Compliance, its inverse, reveals how much the ligament stretches under force. Together, these metrics offer complementary insights, but compliance provides a more dynamic and detailed picture of ligament health. Static points from laxity can only tell part of the story. When compliance curves appear, they reveal critical properties like elasticity and viscoelasticity, showing whether the ligament maintains stability or begins to fail under increasing load. Compliance is not just a metric, it is a new way of understanding ligament behavior. The foundation for compliance was laid in 1995 when Berkovi et al. Conducted a groundbreaking study on over 1,500 knees. Their research demonstrated that compliance offers far more diagnostic precision than laxity, distinguishing between healthy and injured ligaments with 5 times greater accuracy. This study was pivotal in highlighting the limitations of laxity and the potential of compliance. More recently, Puderu et al. Expanded on these findings, highlighting the role of compliance in post-surgical monitoring. Their research revealed how compliance curves dynamically track the ligamentization process during rehabilitation, detecting subtle deviations that signal potential graft issues or failure. To understand why compliance is so powerful, let's compare 2 scenarios of ligaments evaluated at 134 Newton or 30 pounds. Both show a displacement differential of 1.5 millimeter based on laxity, suggesting they are equally stable. But compliance tells a different story. In graph 1, the compliance curve slopes are parallel, indicating consistent ligament behavior under increasing forces. This confirms functional stability and shows that the ligament can withstand real-world demands. In graph 2, however, the compliance curves diverge, revealing reduced stiffness and progressive instability. This dynamic insight uncovers hidden mechanical deficits that static laxity measurements fail to detect. By analyzing the full force displacement relationship, compliance provides a far more comprehensive evaluation of ligament health. Now, if compliance offers such valuable insights, you might be wondering, how do we measure it? Nowadays, compliance analysis has moved beyond research into clinical practice, thanks to robotic arthrometers like the Dyneelax or GNRB. Measuring compliance with arthrometers has become practical and accessible, empowering surgeons to make more informed decisions at every stage of ACL care. In 2023, Cojean et al. Demonstrated that robotic arthrometers achieve an impressive 73.77% sensitivity for detecting partial ACL tears, significantly outperforming MRI's 29.51% sensitivity. Meanwhile, the Dyneelax takes compliance analysis even further by incorporating rotational plus translational stability assessments, addressing the multiplanar nature of knee biomechanics. In 2024, a study by Cojean et al., published in the famous ESSKA journal JEO, highlighted Dyneelax's unparalleled ability to measure medial plane structures in addition to precisely assessing the ACL. With all this data, it is safe to say that the integration of compliance into diagnostics, surgical planning, and rehabilitation monitoring establishes a new gold standard in ACL care, delivering precision and reliability like never before. Compliance doesn't just reveal the full biomechanical picture, it provides a pathway to better outcomes, faster recoveries, and reduced reinjury risks. Visit our website today and embrace the future of ACL treatment, www.arthrometer.com.